So you're looking to become a respiratory therapist, but you're wondering, okay, what shifts or how many hours a week do they normally work? So if you work in a hospital, you're most likely going to work 40 or 36 hours within a week. So if you work 36 hours, you're most likely going to work 3 12s. If you work 40 hours within a week, you're most likely going to do 2 12s, 2 8s, or at my facility, you're also allowed to work a 16-hour shift as well as 2 12s. That way you only have to work 3 days a week. So when you work 3 days a week compared to working 4 days a week, it does make a huge difference. However, that one day that you do work, it's you sacrifice your whole day basically. Before I dive any deeper into this, I just want to introduce myself. My name is Austin Marks, and I currently am a respiratory therapist. I've been an RT for about 2.5, almost 3 years now, and on my YouTube channel I mainly talk about respiratory therapy. So if you want to know anything about respiratory therapy, you can either leave a question in the comments, you can check out some of my other videos. I have plenty of day in the life videos, and so much more. I am also the admin of a Facebook group called the RT Club, and on this Facebook group it's full of respiratory therapists, respiratory therapy students, and in that Facebook group we mainly talk everything respiratory therapy. So if you're interested in that, make sure you head over to Facebook and join that group. So like I said, you're probably going to be working 36 hours or 40 hours a week if you're working in a hospital. However, as a respiratory therapist, you don't always have to work in a hospital. So you can work in outpatient clinics as well, such as PFT or pulmonary function testing. You can do pulmonary rehab. You can work at like senior living places. You can do like long-term care. It all depends, and at some of these places you're most likely going to be doing 40 hours a week. So with this 40 hours a week, you're probably going to be doing 4 10s, maybe you're going to be doing 5 8s. It honestly all depends. I've even heard of some home care companies saying, well, just keep track of your hours. So therefore some of these therapists kind of are all over the place because they're doing home care. They have to go to the person's place or the patient's home whenever the patient is available. So patients have tons of other appointments going on generally, so the therapist may work part of the day, take some of the day off, and then pick up the rest of the day, and then fill out their time for that day. So therefore they're not working 8 straight hours or 10 straight hours. They kind of break it up. It honestly all depends. I've never personally worked home care myself, so I can't tell you from experience. So like I said, you're either going to be working 12 hours, 8 hours, 10 hours, or even 16 hours for some of you crazy people. And yes, I've done plenty of them. Unfortunately, I still do some from time to time, but generally if I do, it's because it's overtime and I want some extra money. So now what shifts are you going to be working as a respiratory therapist? So you're probably going to be, well, if you're working a 12-hour shift, obviously there's only 2 shifts you can work, the first 12 hours of the day and the second 12 hours. So generally those fall between 07 or 7 o'clock in the morning till 7 p.m. and then 7 p.m. until 7 in the morning. However, you can also work in between as well. So I've seen therapists work from like 3 to 3 or 11 to 11. Honestly, it all depends what your facility does. Now, if you do the 8 hours, it's typically from 7 to 3, 3 to 11, and then 11 to 7 o'clock again in the morning. Now, an 8-hour day compared to a 12-hour day, those 4 hours do make a huge difference, which is nice. Now, an 8-hour day compared to a 16-hour day, it kind of feels like you're working a half day whenever you do both at the same time within the same week, so that's always nice. Obviously, if you work a 16-hour shift, it's just going to be 2 8s. So when I used to do it, I used to come in at 3 o'clock in the afternoon and stay until 7 o'clock in the next morning, which is a very long shift, so make sure you bring lots of food. And then typically, if you work in some of these outpatient clinics, your 8-hour days is going to be Monday through Friday. It's going to be you coming in at like 7, 8, 9 o'clock or whatever, and then you're going to stay till 3, 4, or 5. Whatever the case may be, I mean, like I said, it varies from facility to facility, where you work, what their hours are, all that craziness. Well, anyway, I hope you enjoyed this video. I hope it gave you some kind of perspective on what shifts respiratory therapists work. And if you have any questions about respiratory therapy at all, I highly suggest you check out my channel. Like I said, everything respiratory therapy. Hope you enjoyed this video, and see you in the next one.